Our next speaker is a senior technical advisor for VillageReach. VillageReach is also a Skoll awardee and works to increase healthcare access to underserved communities in sub-Saharan Africa. On top of all that, she is actually our first leader that's a doctor. So everyone, please give a warm welcome for Bvudzai.
Thanks, Erin, for that introduction. Hi, everyone. So I grew up on a farm in rural Zimbabwe, a farm that my parents owned. And it wasn't unusual for, my parents every time and again to take one of the farm workers to the nearest health center. Someone had an emergency, a lady got into premature labor, for example, or something else happened. They either had to take someone to a health center or arrange for someone to take a sick farm worker. And so for me, I was always aware from an early age that there are some people who are disadvantaged, either by their geographical location or by other factors, who do not have access to healthcare. And so when I launched my career into global public health, I naturally was interested in the issues of access. And so I started working on various issues on access to health services, access to medicines, and so forth. 9 weeks actually ago, I got a reminder of this experience that I lived through as a young child. I was in Congo doing some work because our organization works there. And our team in Congo was called to an emergency meeting because the health facilities were stocked out of vaccines for children. And so we went for this meeting one evening. We came up with an interim solution, and we were all pleased. And so we walked out of that place feeling satisfied. And as we were preparing to leave and walking in the dark, I stepped into a water drain. And so I injured my right leg. I was rushed to the nearest health center. I got some care, but they told me that they don't have an X-ray machine. And probably I might get an X-ray machine somewhere else the following day. And so the following day, the search started for a place to get an X-ray. The first place we were told, they have a machine, but they are out of X-ray film. The second place we were told, the technician also broke his hand and is out of town. And so we were left with one more place. We arrived there with a sense of desperation, and the technician said, yes, I can help you. That was a sense of relief. And so he said, but we use car batteries to start our X-ray machine. And so they tried on 2 of their car batteries and the machine wouldn't start. So they asked to use our car battery, and we gave it to them. The X-ray machine started, and at least that was a relief. The technician did what they do and took an X-ray, and we sat there for a while, maybe 2 hours, and we got the X-ray film back. I took the X-ray film to the doctors. It was a group of about 4 doctors. They sat with this X-ray machine, with this X-ray that I'm holding right here. And they said, unfortunately, such poor quality, we can't even see what happened. There was no other option for me in that area to get another X-ray. The next flight out of that place was 4 days after my injury. So despite efforts to get me out of that place, nothing worked. So I waited for those 4 days and then flew out of there and got better medical care. So why do I care about the things that I care about? this experience actually reminded me that the issue of access, although it has been spoken about for so long, is still very much real. I couldn't get access to care, although I had some money in my pocket. Not everybody can make 3 or 4 trips until they get healthcare. For some people, if they don't get service once, that's it. And so the work that we do as VillageReach inspires me in that our mission is to save lives and to provide, to ensure that the most disadvantaged get access to quality healthcare. I had an X-ray, but the quality was poor. So it's about accessing the service, and it's about the quality of the service. And those are the things that we care about. There were a couple of other lessons that I learned from this experience. The first thing for me was that we're probably working in the right area, because this is an area where it's really hard to get any kind of service. And so for me, that gave me a sense of reassurance that we're actually working in the right place. The other issue that came to my mind as a health systems and policy researcher was really around how we measure progress. And I know that, as social entrepreneurs, we have indicators, whatever measures we use to measure progress. And I was thinking as I was in that place, what does success look like in this place? And it reminded me that success, yes, the measurements are important, but the context is more so very important. Because what you do in one place, if you do the very same thing in another place, you can get very different results. And so I started thinking, because we have sort of just launched our work in DRC, it's not as old as the other places where we've worked, I thought that you probably need to put 2 or 3 times more effort to get success in this area. And I think it's important for all of us as we reflect on our successes and as we look at those indicators that we care about, that we don't just look at how many, and how many, that we actually take into account the context in which we're working, because everything that we do has a story behind it. The other final lesson that I learned from that experience was how the health system is really fragmented. I had just concluded a meeting to address another public health challenge because the health facilities were stocked out of vaccines for children. And yet, when I was now looking for an X-ray service, the health facility was also stocked out of X-ray films. So for me, this kind of fragmentation where we're each interested in particular issues and sort of forgetting the person as a whole, that, human beings, the same person who requires a vaccine for their child is the same person who requires an X-ray when they get injured. And I was thinking, how can the health system better serve the people? We need a more integrated system, which is holistic and can serve the interests of the people as a whole. And so this is why I urge everybody who is here today that the issue of access is still very real. And this reflection that I had made me realize that I am advantaged in many ways and that other people still need better access to healthcare. Thank you.
Give me a hug. Oh, shoot, sorry.